Good morning, good afternoon, good evening, everyone. On behalf of UNICEF, I'm happy to welcome you to this webinar where we will present the latest estimate issued by UNICEF on October 10 on sexual violence against children. My name is Claudia Kappa. I'm a senior advisor in statistics and monitoring in the data and analytics section of UNICEF in New York. Before we go into the content of the webinar, I just wanted to spend a couple of seconds to let you know that the presentation will be in English, but we have simultaneous interpretation for this webinar available in Arabic, French, and Spanish. You will need to click the bottom of your screen on the interpretation button. Looks like this, like the one that you can see at the center of the slide, and you will be able to select the language of your choice. Again, simultaneous interpretation is available in Arabic, French, and Spanish. Throughout the webinar, you are invited to introduce yourself using the chat box. So indicating your name and your country and your organization if you wish to do so. And of course, we will have an opportunity at the end for some questions and answers on the content of the presentation. And of course, you are also welcome to introduce yourself when you take the floor. Now, without further ado, I would like to start the webinar by introducing Vidya Ganesh. Vidya Ganesh is Director of the Division of Data, Analytics, Planning and Monitoring in UNICEF HQ. Vidya has been overseeing the statistical work of UNICEF, and she's here with us today to share some welcoming remarks. Vidya, welcome. The floor is yours.
Excellent. Thank you so much, Claudia, and a very warm welcome again to all of you. It's great to have you join us, and the interest is both important and significant. As today, for the first time, we get to look at the overall new estimates of the sexual violence against children, which Claudia and team will take us through in a bit more detail. But there are just a couple of reflections I wanted to share as we jointly embark on this journey together to not only dream, but actually ensure that there is collective evidence-based action to eliminate this horrible situation that our children face. I mean, the while this is exciting to have finally a new estimate on sexual violence against children, and that too at a global level, and Claudia will take you through all of the limitations, but at the same time, the numbers are horrifying and they're alarming, and sometimes we may wonder why this is the first time such estimates have been produced. I mean, those reasons go to the heart of really needing to have the collective action, the commitment to address this colossal human rights violation that has been happening long amidst us. And on the data side, it's been difficult to quantify this, largely due to the stigma, the measurement challenges, the definitional challenges, and sadly the limited investments that has been in data collection, use, and analytics in a way that is suitable for program response and scale up and policy advocacy that is absolutely critical. So the three elements, the data, the programmatic response at scale, and the policy advocacy that is aimed at all levels of society is absolutely critical. But we do know a few things. In the last 20 years, there has been increased attention to the violence against children, yet many countries have lacked data which demonstrates that violence has not received the same priority as other issues on which statistics, data, and programs are regularly designed and used by the governments. But that will change now. It has got to change, and we have to commit towards it. So documenting the violence against children in all its forms, again, the definition is important so that we are very pointed in our evidence generation, and it also helps with the policy responses, that so data is really the first step, and because with the numbers comes responsibility. So we really need to have large-scale efforts for global monitoring for violence against children, against all contexts in all countries. So let me point to a couple of things that are really have been important milestones to get us to that level of ambition of having global level program on data collection use for program and policy response. So UNICEF, in its capacity as custodian agency for the SDG indicator, as you all know, 16.2.3, as well as on the 16.2.1 on violent discipline at home. And this has been an important and a role that we take very seriously, and which we are committed to, so that we can come up with standardized processes of data collection. So two important advances have happened, which really help us speed towards these efforts. One is last year, finally, the International Classification of Violence Against Children was released. This is the first ever internationally agreed statistical standard on this issue. And as you know, this has been after a long process of consultation, both on definition, culturally relevant understanding of this phenomena, and it's applicable for cross-country comparison. So this is absolutely a critical breakthrough that we had, which I hope all of you have had a chance to understand and internalize. It's not enough to have the classification. You also need to have the means of data collection. And as part of our current 7th round of the UNICEF led and supported multiple indicator cluster survey, the global mix program that I hope many of you are familiar with, and most importantly have done the surveys and used them. This will be implemented in 40 countries, and which will have the new data modules on intimate partner violence, sexual violence against children, and bullying, as well as existing modules on violent discipline and attitudes towards domestic violence. So we have in our hands for the first time solid tools through which we can really generate the evidence that is required to really once and for all eliminate this horrendous practice globally. So alongside the data collection efforts, it's also critical that we get together to foster the analysis and dissemination. And I know Shima and team will speak to that, so that the data for children leads to data for action, and we can overcome the violence. The children can overcome and prevent and we can prevent them facing such terrible situations that has a long-lasting effect, and not only through their childhood but all through their adulthood and sometimes into the next generation. So my friends and colleagues, ending sexual violence against children is a global imperative. It's our moral duty, it's our moral responsibility, and we can do it. So I really hope you'll join and contribute to the sustained and concerted action commitment to make this a reality. All the best to all of us, and to you in particular. Thank you so much.
Thank you so much, Vidya, for your opening remarks. It's now my pleasure to welcome Shima Sengupta, who is Director of Child Protection and Migration in UNICEF headquarters. Shima, the floor is yours. Thank you.
Thank you, Claudia. And very, very pleased to be here. So good morning, good afternoon, good evening, whatever it is to everyone, but really pleased to be here. And following on from what Vidya said, this is really such an important subject, because it really is one that is deeply painful. And any one of us, anyone and all of us, we feel this pain and hurt when we think about all those kids out there. So while it is painful, these first ever global and regional estimates on sexual violence in childhood are incredibly significant, as you just heard from Vidya as well. For way too long, child sexual abuse has been hidden and stigmatized. Confronting it means bringing it into the open and challenging beliefs that say that doesn't happen here. All too often we hear that. The data shows this couldn't be further from the truth. Sexual violence in childhood is a pervasive and devastating issue. It affects children in every region. It affects both girls and boys, and it occurs in all settings, including those spaces that are meant to be protective, such as families, schools, faith communities, and child-serving organizations. Tragically, many children do not receive adequate support and they're unable to access justice. And in some cases, victims actually face further harm through their contact with the authorities. So really, as we just heard from Vidya as well, we really need to do better. And so why is it so critical to prioritize this issue? Firstly, this is an ethical and legal imperative. Every child should feel safe at home, in school, in the community, and online. And this fundamental right to be protected from sexual violence is enshrined in the Convention on the Rights of the Child, its optional protocol on the sale of children, child prostitution, and child pornography, and other international human rights treaties and standards. The international community has also set explicit targets within the Sustainable Development Goals, including Goal 16.2, to end all forms of violence against girls and boys by 2030. Secondly, sexual violence has far-reaching individual and social consequences. And I know if you take a moment to reflect, every one of us have met or do know of kids or adults who actually have faced this. Children who endure such trauma are often carry the effects into adulthood. They face an increased risk of sexually transmitted diseases, substance abuse, social isolation, and a host of mental health issues like anxiety and depression, as well as challenges in forming healthy relationships. And this ripple effect undermines the potential of entire generations, impacting both the lives of the survivors and the well-being of our societies. Thirdly, the widespread adoption and rapid evolution of digital technology are presenting new challenges. The internet and digital technologies have amplified existing forms of sexual violence, enabled abuse on an unprecedented scale, and created new forms of harm. Many of the non-contact instances of sexual violence reflected in these estimates involve abuse enabled or facilitated by technology. These include unwanted sexual messages or images, online viewing of child abuse material, and online grooming for sexual abuse. And I know many of you who are in touch and who have been watching the news have seen, the latest cases that we really, it sends a shudder, when you think about one person sitting in one corner of the world could actually abuse over 3,500 girls across the world, across 30 countries. As we move forward, we must accelerate our efforts to prevent and respond to child sexual abuse. The data in these global estimates should inspire us to drive evidence-based, scalable strategies that tackle the drivers of sexual violence against children. So we look forward to collaborating with all partners to see that every child can live a life free from sexual abuse and exploitation. So I really look forward to the outcomes of this session in terms of partnerships and collaborations and programming to keep children safe. Thank you.
Thank you so much, Shima. And then it's my pleasure to go into the presentation of the estimates. Of course, this report is the result of a collaboration with many individuals and experts who contributed in different capacity. So before presenting the estimates, I just want to take a moment to acknowledge the contribution of the following individuals and institutions, starting from colleagues from UNICEF headquarters, Nicole Petrosky, who will be taking the floor later, Colleen Murray, Badar Jager, and Isabel Gijon from Data and Analytics, and then from the program section division of child protection. I wanted to acknowledge Stephen Blight, who will be later on take the floor, Monica Darer and Afruz Vianney, but also I wanted to take a moment to acknowledge the many external partners who contributed to these estimates. In the spirit of collaboration, we are very grateful for the time and expertise they provided. And in particular, I wanted to acknowledge Ben Matthews from the Queensland University, also the Jiaoming Fang from the China Agricultural University, Daniela Ligero, Begoña Fernandez, and Costanza Ginestra from the Together for Girls. And there were more than 20 national statistical offices who contributed to the thinking that went into the estimates. They attended an expert consultation in New York in April, more than 20 organizations, so I won't be able to name all of them, but I'm pleased to see that some of the statistical offices that contributed directly to this estimation work are present with us today, including the National Statistical Office of Italy, Jordan, China, India, Cameroon, Cote d'Ivoire, Fiji. So let's now go into the presentation of the estimates. And that was, as was mentioned by Vidya at the beginning of the webinar, when measuring violence against children, the starting point that is critical to understand what these estimates are about have to do with definitions. Thanks to the release last year of the International Classification of Violence Against Children, we finally have internationally agreed operational definitions of violence against children, which have long been missing in the international field. In the absence of internationally agreed standardized definitions, it becomes very difficult, if not impossible, to come up with comparable statistics that can be used to track progress towards certain goals and targets. And this is why the International Classification of Violence Against Children is a critical contribution. Over the last 10 years, the field of measurement of violence against children has been populated by many different data collection efforts. Unfortunately, however, these data collection efforts employed different definitions, different data collection instruments, different protocols for data collection, which have all resulted in data of varying quality, but also data that can rarely be compared across countries and over time. And as we know, for the purpose of monitoring progress towards certain issue, it is essential that the same definitions are used across countries and over time. In the International Classification of Violence Against Children, there is a dedicated section that regulates sexual violence. It defines sexual violence against a child as any deliberate, unwanted, and non-essential act of a sexual nature, either completed or attempted, that is perpetrated against a child, including for exploitative purposes, and that results in or has a high likelihood of resulting in injury, pain, or psychological suffering. Within the classification of violence against children, specifically the sexual violence chapter, acts of sexual violence are then classified in two main categories: contact forms of sexual violence, such as rape and sexual assault, as well as non-contact forms of sexual violence, which include a variety of different acts. Some examples of these acts include sexual harassment, online solicitation, exposure to sexual abuse and pornography, persisting luring looks, unwanted sexting, and non-consensual image taking. So this non-contact category is much broader and diverse than the contact forms of sexual violence, and has not been the subject of dedicated data collection and investment. There have been, especially in the last 10 years, initiatives that aim at filling the data gaps by providing standardized tools for collecting information on children exposures to non-contact sexual violence. But it's true that historically, data collection has mostly focused on contact forms and more specifically on rape. So an important consideration before we go into revealing the actual number has to do with the current data landscape when it comes to violence against children. Vidya was very clear in her remarks. The collection of data on violence against children has not been prioritized. And as a result of this lack of prioritization, the availability of statistics, high quality, large scale official statistics on violence against children remain limited. So in reviewing the available data, we were confronted with the challenge of having to identify and classify the available data sources into 3 categories, depending on the level of standardization and coverage of these data sources. How did we go about identifying the data sources? Over the last 9 years, following the adoption of the Sustainable Development Goals and specifically the targets and indicators related to violence against children, UNICEF as custodian agency for the SDG indicators related to violence against children has started country consultation processes. Every year, over a period of 3 months, UNICEF is in direct contact with national statistical authorities of all countries in the world. And the purpose of this consultation is to identify data sources for each one of the indicators for which UNICEF is custodian agency, including, therefore, the indicators related to sexual violence against children, which is the SDG indicator 16.2.3, and the SDG indicator 16.2.1, which refers to the experience of violent discipline at home. In the process of reviewing and identifying the data sources with the national statistical authorities, there is a very thorough review of the data sources that has to do with the definitions that are used in the different data sources, the coverage of the population that is captured through this data collection, the type of protocols that are used for implementation, so on and so forth. And we know that in the case of violence against children, above all different topics, everything counts. And what I mean by that is, depending on the definition, depending on the words used to ask the question, depending on the profile and the training of the interviewers, depending on whether or not strict ethical protocols are put in place, all these elements that have to do with design of a survey and a questionnaire, as well as implementation of the data collection, all these elements may affect tremendously the quality of the estimates and the overall range of the estimates. Questionnaires that use stigmatizing language, that are very narrow in scope, that are implemented without proper training of interviewers to facilitate disclosure of the traumatic experience, but also to retain confidentiality. All these elements, for example, are known to produce lower level of sexual violence, not because the levels are actually lower, but simply because disclosure of the actual experience of sexual violence is compromised if certain protocols are not put in place to safeguard participants to the data collection and to retain data quality. So we compiled this evidence over several years with support from national statistical offices across the world. And as a result of this data compilation exercise, we organize the available data sources into 3 tiers. Tier 1 include data sources that are considered to be largely comparable across countries, and they are therefore included as such in the official SDG database for indicator 16.2.3. which UNICEF compiled on behalf of the member states. These are large-scale household surveys, mostly demographic NEL surveys, as well as some multiple indicator cluster surveys where questions related to children exposure to violence are incorporated as part of a multi-topic survey. Tier 2 include other nationally representative surveys meeting some predefined parameters, and these include the VAC survey that have been conducted in a number of countries across the world, with a particular focus in sub-Saharan Africa, as well as regional surveys on violence against women, which incorporated questions on children experience of sexual violence. And then tier 3 obviously include a number of sources that do not meet the criteria for tier 1 and tier 2. And of course, all of these sources, tier 1, tier 2, tier 3, have limitations. And we had to make adjustments at the regional level to address some of the limitations that still exist when it comes to measuring violence against children. These limitations, the nature and the range of the limitations vary, obviously, depending on the country and the data source. But the adjustment were mostly justified by the need to account for missing information. For example, in many cases, we found that the victims could not report the age at which the first incident of sexual violence occurred. So we had to make adjustments for this missing information. But in some cases, we also had to make adjustments because the definitions were more limited than the scope of sexual violence we wanted to capture. In this graph, at the bottom of the slide, you will see the current data availability organized by these 3 different typology of data sources. And what is important to observe is that overall, in the world, we have approximately 60% of countries which have a type 1 or type 2 data source on sexual violence among females. So we have 41% of countries that do not have a type 1 or a type 2 data sources, and therefore they are unable to report on children experience of sexual violence. But if we look at the variation across regions, we can see that actually there are certain regions that are particularly data poor when it comes to collecting data on women's experience of sexual violence in their childhood. And these include, for instance, Northern Africa and Western Asia, where 71% of countries do not have any large-scale survey that can be used to get a sense of the prevalence of sexual violence. And let me pause for a second to underscore the last point that I made. To establish prevalence of sexual violence, meaning how many women and men have been affected by sexual violence in their childhood, it is essential to have survey data. We cannot use administrative records. Why? Because administrative records are gathered in the process of delivering a service to victims. And we know that only approximately 1% of victims of sexual violence in childhood reach out for help and receive services. So it would be a gross underestimation to base any type of study or analysis of how widespread the exposure to sexual violence is by relying on administrative records. I want now to take a moment to review the availability of data in the case of sexual violence against boys. And this is what this graph displays. It's the same graph as before, classifying the different sources of data on sexual violence. In this case, it's against boys. And in both cases, for boys and girls, we are talking here about the availability of data on contact forms of sexual violence, which, as I mentioned earlier, have overall a much higher data availability than non-contact forms. If the situation was particularly dire when it comes to the availability of data on females experience sexual violence in childhood, the situation is actually worse in the case of the availability of data on boys. As this graph shows, 83% of the countries in the world do not have any reliable large-scale data source that can be used to understand how common the prevalence of sexual violence in childhood is for men. Certain regions of the world have absolutely zero data sources. So, and again, we're talking here about population level prevalence data. Why is this the case? Well, a number of different factors, but of course, there is also the added stigma and assumptions that boys are not at risk of sexual violence, which we know is false. So this publication had to deal with the issue of limited data availability, and particularly for certain types of violence, the non-contact forms of sexual violence, and in particular for certain population like boys. So because of this limitation, you will see later on the estimates I will present for boys and for non-contact forms of sexual violence have limitations, and these limitations resulted in our inability to present regional level estimates for boys and for non-contact forms of sexual violence, both for boys and for girls. Additionally, the estimates for boys will be presented with a significant range because, again, we had to generalize to a large population the data that were available only for a limited population of boys worldwide. So as a result, and I want to go over this very quickly, I just wanted to summarize what is the coverage of our estimates for the group and the type of violence that has the best coverage, which is female and contact forms of sexual violence. The estimates I'm about to present cover approximately 81% of the world population of girls and women. The largest population coverage is available in Central and Southern Asia and Sub-Saharan Africa, where we have data for more than 90% of the female population in these respective regions. There is only one region where population coverage is below 50% for females and contact forms of sexual violence, and this is Northern Africa and Western Asia, as I mentioned earlier. So very quickly again on the methods, I mentioned at the beginning that in light of the limitations that continue to exist when it comes to the measurement of sexual violence, we had to pull together different sources, and these require different type and nature of adjustments across regions. And in order to continue to support the collection of standardized data, later on, Nicole Petrosky will present the work that UNICEF, in collaboration with many experts, is leading on developing a new set of questions on sexual violence in childhood that can be used across countries to collect data on a core set of indicators related to sexual violence. And here we go. We are finally at the level of presenting the estimates that are resulting from this methodological work. According to this estimate, we believe that approximately 650 million girls and women alive today have been subjected to sexual violence in their childhood. So these include approximately 370 million girls and women who have experienced rape or sexual assault in childhood, together with approximately 280 million girls and women who have experienced only non-contact forms of sexual violence, which include the examples I provided earlier related to sexting or persisting and leering looks, sexual harassment. This number of 650 million females include two subcategories. 50 million of these 650 are girls who are minors. So they are currently alive today, they are below the age of 18, and they have already been victimized. But 600 million of the 650 are adult women who were subjected to sexual violence as children. We wanted to acknowledge these victims and survivors in these estimates because we know that sexual violence in childhood has repercussion throughout the entire life of the victims and survivors. So again, the estimates that we are presenting today point at 650 million girls and women who have been victimized. Looking at the geographical distribution of these victims, the largest number of female victims of rape and sexual assault is found in some of the most populous regions of the world, namely in sub-Saharan Africa, which is home to 79 million victims, followed by Eastern and Southeastern Asia, and by Central and Southern Asia. This is the overall global distribution. And again, here we are talking about contact forms of sexual violence among the female population. Now, looking at the prevalence, meaning the proportion of women out of the total number of women existing in these different regions and in the world, we can see that globally, 12%, or approximately 1 in 8 adult women have experienced sexual violence in childhood. And if we look at region by region, at the prevalence region by region, Oceania stands as the region with the highest prevalence of sexual violence in childhood. In this part of the world, approximately 1 in 3 adult women report experiencing sexual violence in childhood, followed by Sub-Saharan Africa, which stands at approximately 22%. We have to take these regional estimates with obviously a grain of salt. There can be many different reasons why there is variation in these estimates across regions that have to do with the actual issue itself, norms related to sexuality, norms related to women, lack of services and policies to prevent and address the issue. But there could be also some data issues, because we know that cultures, awareness influence not only the actual talking about the issues and addressing the issue, but also the collection of data on the issues. So while we have tried to minimize this variation due to non-data factors, it's still important to acknowledge that there could be still some effect of this data gap that affect also the reliability of the estimates. We took a moment to also look at the levels of sexual violence among women by income groups, as well as fragility and conflict situation. And this is what these two graphs shows. Overall, we see that the level of sexual violence varies. In the case of low-income countries, the prevalence of sexual violence in childhood, which is globally stands at 12%, is actually 26% when we look at this prevalence in low-income countries, for example, followed by high-income countries at 15%. And when we look at a fragile situation and countries in conflict-affected situation, we can also see that the risk of experiencing sexual violence is significantly higher, is 27% prevalence of sexual violence in childhood among female population in countries in fragile situations, following the World Bank classification of fragility, and 21% in countries in conflict-affected situation, following again the same classification. And I'm gonna conclude the review of the estimates looking at the situation when it comes to boys, with the caveats I mentioned earlier. Globally, we estimate that between 410 and 530 million boys and men alive today have been subjected to sexual violence in childhood. And these include between 240 and 310 million who have experienced rape or sexual assault during childhood. Of this estimate, again, we have to consider that part of this estimate include boys who have been already victimized and they are still minors. These amount to approximately 40 million, as well as adult men who were subjected to sexual violence in their childhood. In concluding my presentation, I wanted to share, obviously, the resource page where you can find this publication, as well as the International Classification of Violence Against Children and other publication that we issued on the topic. This is our data website, data.unicef.org. There is a dedicated page with statistics and publication which are data-driven related to violence against children. And I encourage you to visit this page. And obviously, as UNICEF, we remain committed to supporting member states in the collection of high-quality data on the experience of sexual violence against boys and girls. Ensuring that such violence is documented through solid data is a first step towards its elimination, because as Vidya mentioned earlier, with numbers comes responsibility. We know very well that action is needed, and sometimes action needs to be taken even in the absence of data. There is no question about that. But having data like the one that we issue today allow us to bring even more visibility to the issue and strengthen accountability. Because when victims are counted, they are no longer invisible. And the promise of protection that has been mentioned by Shima in her opening remarks becomes a real possibility. How do we go from a possibility to a reality? It's through the adoption of data and evidence-driven interventions, which will be the subject of Stephen's intervention later on. Thank you so much for your attention. There will be a Q&A later on, and I will be happy to answer any additional question you might have. It's now time to hand over the floor to Nicole Petrosky, who will provide an overview of the methodological work UNICEF is leading for developing new survey questions on sexual violence. Thank you again for your attention, and over to you, Nicole.
Thank you very much, Claudia. I'm just going to very briefly speak about the methodological work, as Claudia mentioned, that we've been doing initiating over the last few years, with support from a very generous grant from the Oak Foundation. So as Claudia was mentioning earlier, of course, the rationale for embarking on this work was in response to the proliferation of different measurement activities and data collection efforts aimed at filling the existing data gaps that we've seen over the last 20 years or so. And a recognition that these efforts, of course, have resulted in increased data availability, but have often been sporadic, limited in coverage, and often not generating data that are globally comparable. So as the custodian agency for SDG 16.2.3, part of the mandate that UNICEF holds is the development of internationally agreed methodologies and measures that allow the collection of internationally comparable data on the SDG indicator for global monitoring. And the overall goal and vision for this methodological work is to develop and also validate new survey questions about sexual violence in childhood, so about sexual violence experienced by both boys and girls, for inclusion in multi-topic household surveys or in dedicated standalone surveys. And we also plan to develop the accompanying implementation tools and guidance to support its uptake and use. Some key principles that we are using as we go through this methodological work include country ownership and country involvement throughout the process, data system strengthening, and sustainability. So developing a set of questions that can be integrated in existing data collection efforts and that would not require necessarily a separate standalone survey to be able to collect the data. Some of the overall parameters for these new survey questions, we are aiming to prioritize feasibility and practicality over precision. So this is meant to generate data at the population level. So we're willing to compromise a little bit on precision in order to develop and validate a set of questions that is very feasible and practical for countries to use. So questions that are simple, can be easily understood by a wide variety of respondents that come from very different backgrounds, that can be easily administered by generic interviewers who are trained in the administration of these questions that are short and in terms of the overall number of questions. And again, very key that we are keeping things very practical so that this is something that countries can integrate again into their existing data collection efforts. We plan to define both a short or core set of questions that would allow the collection of data on prevalence, so overall prevalence of sexual violence and the different types of sexual violence, aligned with the International Classification of Violence Against Children, and then also an optional extended longer set of questions that would allow countries to collect additional contextual information about sexual violence incidents. And throughout this process, we are using the ICVAC as our guiding conceptual framework in terms of to define which forms of sexual violence to cover. So these new questions will include questions about the three main categories that are defined in the ICVAC, which is rape, sexual assault, and non-contact forms. So we will be including questions on all those three types. And I won't go through this in detail, but we've articulated a roadmap for this methodological work. It includes a desk review and scoping exercise that has already been completed, was started in 2020, and we revised and expanded it last year to look at the existing data collection tools and questions that are out there. We compiled more than 500 individual items and questions to create a bank, an inventory of questions. As Claudia was mentioning, we brought together a group of experts in New York in February of this year for a technical consultation where we presented the results of this desk review and got the inputs and feedback from many experts into the content of the questions. And we are now in the process of revising the set of questions, consolidating the feedback from the technical advisory group to prepare a set of questions that will go for the next steps of validation and testing, which includes a series of technical steps that are really imperative when we're developing new survey questions to ensure that they are validated appropriately. And we'll be consulting throughout this process with the technical advisory group. The end product will be a final set of questions that will, again, be accompanied by supporting implementation tools and materials for the use of those questions. So including things like the interviewer guidelines, for instance, the training materials for the interviewers, et cetera. And we will also, from UNICEF's side, provide technical assistance and support once the final questions are ready for country uptake and implementation. And then just a quick acknowledgement, as Claudia said, we have a technical advisory group that's been supporting with these different work streams around measurement of violence against children. The meeting that we had in February in New York brought together over 40 representatives from these development and UN partners and experts from academic and research institutes, as well as representatives from the national statistical offices and relevant line ministries in 20 countries that are listed there. And we thank them all very much for their contributions and their willingness to contribute and actively participate in these different work streams that we are embarking on. Thank you very much.
Thank you so much, Nicole, for your presentation. And I see that the chat box is being populated. We might not have enough time for a Q&A, for a live Q&A, so please feel free to use the chat box to ask your question and we will attend to them as soon as possible. It's now time to introduce Stephen Blight, who is Senior Advisor for Child Protection in UNICEF New York. Thank you, Stephen, for joining us. The floor is yours.
Thanks, Claudia. Next slide, please. As part of the release of these estimates, UNICEF has issued a 5-point call to action. It calls upon states and stakeholders to tackle sexual violence against children systematically and holistically. So I'll now go through this call to action highlighting the priority program interventions that support it. These interventions that I'll mention were identified as best practices as part of our 2020 evidence review, Action Against Child Sexual Abuse and Exploitation. Next slide, please. The title's missing. Yeah. Firstly, we must challenge and change harmful social and cultural norms that allow abuse to occur and that discourage children from asking for help. Key issues to target include gender inequalities, social norms related to masculinity and male sexual entitlement, and the prevalence of hostile, disbelieving, and stigmatizing attitudes towards victims. Some promising interventions include school or community-based education that target harmful gender norms and values. These include curriculum on healthy relationships and safe dating. Sex education and HIV prevention programs for boys and girls have been found to reduce transactional sex and intimate partner violence amongst young people. And involving men and boys in violence prevention can also be helpful through mentoring, through community engagement, and through bystander programs. Normalizing open conversations about abuse can reduce stigma and help to dismantle the harmful norms around it. Next slide, please. Next slide. There we are. Secondly, we must equip every child with clear, accessible, and age-appropriate information about their rights and how to seek help, empowering them to recognize predatory behavior and to report sexual abuse. For example, there's promising evidence around keeping safe education for school children. Such programs can improve children's knowledge about sexual abuse, about safe and unsafe touches, about who to tell, while at the same time averting adverse consequences such as increasing fears. Parenting programs that improve parenting skills have been found to be effective in improving parent-child communications about sex and safety. And child helplines can empower children to seek help safely. They often serve as a crucial front line of support when children are in distressful situations and connect them with services. Next slide, please. We must ensure that every child victim and survivor has access to services that support justice, healing, and that reduce the risk of further harm. This requires a multidisciplinary response, including social services, healthcare services, and justice. Integrated service models, such as one-stop centers, can provide comprehensive support to children under one roof. We also need to improve participation of, advocacy for, and accountability towards children in such services. They must be user-centered by prioritizing the child's needs, safety, and well-being. This includes providing trauma-informed care, respecting the child's voice and choices, and ensuring confidentiality. Sexually exploited adolescents may be resistant to traditional child protection responses due to a lack of trust in public institutions. So specialized outreach and advocacy models that respond to their immediate needs, such as food, shelter, healthcare, can build trust and be part of a staged approach to safety, recovery, and reintegration. Next slide, please. Fourthly, we must strengthen laws to protect children from all forms of sexual abuse and exploitation and invest in the people, resources, and systems needed to implement them. This includes legal frameworks that protect children in organizational settings, such as in schools and care facilities, and from other service providers who are in contact with children. Now, while progress has been made in aligning domestic legislation on sexual violence with international human rights standards, gaps and anomalies in law are still leaving children falling between the cracks. Laws that need to be reviewed include those that reflect appropriate minimum age of consent to sexual activity, ensuring equal legal protection for boys from sexual exploitation and abuse, the exclusion of certain acts from criminal laws, including those non-contact forms of sexual violence, and the removal of statute of limitations for sexual offenses against children. There's also an urgent need to update legislation to address online or technology-facilitated sexual exploitation of children. In addition to criminalizing child sexual exploitation and abuse, states must introduce measures to support victims and witnesses in the justice system to make sure they have access to redress. And finally, last slide. We must build better national data systems to monitor progress, to better target interventions, and ensure accountability. Such data systems should include administrative data, that is real-time data collected at the point of service delivery, such as from the police, health services, education, and social services. And they should include regular population-level prevalence data on the different forms of violence against children based upon survey data. Investing in national data systems using this common statistical classification known as the ICVAC, when countries have ownership of their data, makes it more likely that they will prioritize violence against children in their public policy agendas. Back to you, Claudia.
Thank you so much, Stephen, for your intervention that allow us to put together the data, the evidence, and the action. So unfortunately, we have no time left for questions other than 2 quick minutes. And I see that we have some participants, they have their hands up. So I just wanted to take a moment to check if indeed there are questions on the audience side. Of course, we have used the opportunity to answer the questions through the chat box. But of course, we are happy to, if there are any burning questions, we are happy to address them. So we have 1 minute for questions. So please feel free to raise the hand. I see that those who had raised the hand have lowered them. I see that Vijaya Sudha, the hand is up. So Vijaya, would you like to take the floor?
Yes, ma'am. Am I audible?
Yes, yes, you are.
Yeah. So through the data which I have seen through your PPTs, I could understand that lower income countries are reporting more violence against the children. Why is it so? Are they not focused with reference to their life requirements, or is the poverty making them to indulge in criminality?
Thank you, Vijaya, for your question. And I saw it on the chat box and I was very quickly trying to answer it. There could be many different reasons why these countries have reported levels of sexual violence that are higher. It can be a combination of different factors, including some social norms, together with the absence of policy framework, absence of services to prevent. So it's very difficult to identify a single reason. Normally, there is a combination of different reasons that can explain this variation in levels according to the income countries. Income in itself is not necessarily a factor, but it's rather the absence of resources in a broader sense that these countries might have. And of course, Stephen, if you'd like to come in, please feel free to do so as well.
So that means we need to develop a comprehensive scheme for those countries.
Absolutely.
To address these issues by identifying all the reasons, probable reasons.
Absolutely. And the presentation by Stephen gave us the opportunity to really reflect around the different things that needs to be in place in terms of services, in terms of legislation, in terms of policies for this issue to be tackled across all countries. Thank you, Vijaya.
Thank you. Thank you.
Thank you. Sandra, and with Sandra, we close the Q&A. I see the hand from Sandra disappeared. So thank you so much for listening to our webinar, and thank you in advance for anything that you wish to do to help disseminate this publication and use it to advocate for more investments programmatically and also in terms of data and research. Thank you for being with us today. UNICEF plans to release these estimates at regular intervals. So we are going to continue to compile data sources. We're going to continue to work with member states to support the collection of quality data, and we will continue to use this evidence and data to advocate for action on sexual violence against children. Thank you so much again for your participation, and I look forward to seeing you again or connecting again through other fora. Thank you, and on behalf of UNICEF again for your participation. The webinar is now closed. Thank you. Goodbye, everyone.